So, Amelia, I have been asked many times, what are the differences between JSO and a typical high street practice? So I thought that we'd make a short film to explain. Let's start with the JSO eye examination.
Well, first of all, the whole examination is carried out by me, the optometrist. I will assess the vision, the eye pressures, the visual fields, and check the health of the back of the eyes with the help of retinal imaging and scans. And we find it is most important for the safest and the best eye examination for it to be carried out in the privacy of the testing room with one optometrist.
And we're often asked, when can children have their eyes examined? And the answer to that, as you know, is that there is no age limit. I think if people have concerns, they can bring a child at any age. Probably if the child's vision seems fine, then age 3 is quite a good time to start. And we love examining children, don't we? There are so many different props and clever methods we can do to examine a children's eyes. We have the brilliant clown image sticking out his tongue. We've got pictures, we've got shapes. So there's no need for a child to be able to read. We can assess their vision happily without that. And of course, eye examinations for children are free.
Shall we talk about the other services that we offer?
Gosh, let's see if I can remember them all. What should we start with?
Contact lenses.
Such an important part of our work. We fit any and every contact lens under the sun to any age. I think it is so important to be able to give people that choice, that freedom of wearing contact lenses, whether it is in a social cosmetic situation, perhaps giving someone more self-confidence in school because they're quite self-conscious wearing spectacles, or whether it gives them the freedom to go skydiving, playing sport. Just contact lenses can really change their lives and give them the freedom to do things where spectacles can be restrictive.
And then there's the specialist contact lenses that we do. We fit these to patients with keratoconus and after a corneal graft surgery, and these patients often can't tolerate their vision in spectacles but can in contact lenses. We also do cosmetic contact lenses for people with damaged and scarred eyes, and also coloured contact lenses for those people who suffer with visual stress and migraines.
Visual stress, that's another important service we offer.
But we haven't finished with specialist contact lenses. What about Ortho-k?
Oh, Ortho-k. My favourite. Such a brilliant way to give people complete freedom from spectacles and contact lenses during the day by fitting them with contact lenses that they wear overnight. People think we are a bit mad asking them to sleep in their contact lenses, but it is completely safe and it works beautifully, with the added bonus of slowing their progression of short-sightedness, especially in young people.
I started wearing Ortho-k lenses when I was 7. At first, I struggled a bit and I needed some help with my parents for the first week. Now I can do it by myself easily without thinking. I really like them now because I don't need to worry about glasses or contact lenses during the day, and I can do swimming and sports like that without worrying.
Oh, isn't she brilliant? And do you know, Eloise had -3 diopters of short-sightedness already at age 7 and was progressing rapidly. And ever since she's been fitted with Ortho-k, her short-sightedness has been completely stable. So quickly, move me on past Ortho-k. I could talk about it all day. What else do we do?
Visual stress. I just love my work with visual stress. You know, it's so rewarding to take a patient who's struggling with their reading and their writing and academic studies and make them have a real passion for reading. We do this through the use of spectacles and contact lenses. Obviously, the spectacles and the lenses are custom made, whether the patient suffers with scotopic sensitivity, which is glary backgrounds, so we give them a coloured tint for that. Or if they need varifocals to help with focusing difficulties, we can provide that. And also, we can provide prism for binocular vision problems. Should we hear from Amy to see how she's getting on with her visual stress spectacles?
When I'm reading, the words just jump around the page, and with the glasses, the tint just holds it still for me to read. My eyes get really tired really quick, but the glasses will just help with that and will show some, give me some resistance for how long I can keep them relaxed. At school, I normally get quite bad headaches because if I'm looking at the screen, I can't see it that well because it's really blurry and my head is just whizzing. but the glasses will just help those ideas settle down into place exactly where I want them, and then the headaches will just like gently go. The tin, it will like calm any really bright like light or glary things that I see down, so like my eyes can bear them really easily without having to strain.
Gosh, she's doing brilliantly, isn't she?
And what's next?
How about the enhanced services we offer throughout the 3 practices?
Goodness, where do we even start?
How about the urgent eye care services we can offer throughout the region that the 3 practices cover? So in Wrexham, we call it EHU, so Eye Health Examination Wales, which allows us to manage patients with urgent eye care needs and specialist needs. And in Cheshire, this is called CUES, and in Shropshire, it's called MEX. These enhanced services have always been vital, but they have been especially important over the last 2 years during the pandemic, allowing us to take the pressure off GPs and hospital eye clinics and manage patients within the practice.
And the added bonus is that you and Sarah are both independent prescribing optometrists.
Absolutely. Let's ask Sarah all about being an IP optometrist.
Well, Jane, you and I have got our IP qualification, which means we're independent prescribing optometrists. The joy of this is that we can clinically assess, establish a diagnosis, create a treatment management plan, and prescribe when necessary for conditions affecting the eye and the surrounding tissues. Again, this service has been much needed over the last couple of years during the pandemic. It's allowed us to treat a number of conditions in practice without the need of referring to the hospital. And here's one of our happy patients.
Having 2 recurring eye conditions, uveitis and shingles, it's imperative that I receive treatment as soon as possible. It's such a relief that Jane, being an independent prescriber, can prescribe the medication that I need. It's what sets Jane apart from other opticians, which results in no more sitting at the hospital for hours on end waiting to be seen.
Gosh, Jane, you really helped that lady.
Yeah, I love my IP work. It just makes such a difference. So, what other enhanced services do we offer?
Other enhanced services, well, we've got pre and post cataract assessments for patients who have had cataract surgery. We've also got the glaucoma referral refinement scheme for patients that we suspect may be suffering with glaucoma. And you can also see a private ophthalmologist in one of our practices for assessment, management and treatment.
Hi, I'm Dan Newen, a consultant ophthalmic surgeon. I specialise in lens replacement, cataract surgery and glaucoma. However, I can also see a wide range of eye issues. I've known Jane and her team for 10 years now, and our ethos has always been to provide accessible, essential, high quality eye care. At our Wrexham practice, we're now able to offer laser. Commonly after cataract surgery, one can develop cloudiness over the lens implant. This causes blurring and mistiness of your vision. People wonder whether their cataract is returning. It's not. We can treat this. We can restore that clear, sharp vision you had soon after your cataract surgery with a simple, straightforward laser in the clinic. This laser is also able to be used to treat and prevent glaucoma. So our aim has always been to ensure that you don't have to wait, that you're able to access essential eye care for your needs so that you can continue to enjoy your vision to its fullest potential.
It's been so great having Dan running clinics in the practices, especially during the pandemic. It was really allowing people to access essential care. And now we're doing our glaucoma shared care for patients who haven't been seen in the glaucoma clinics at hospital in England and Wales. And instead of going to the hospital, because obviously all the clinics are packed, they're coming to see us for their glaucoma assessments in the practices. And they're just so pleased and happy that we can see them, they're not having to wait hours in hospital, and these are scared patients who are being looked after, so that's a really great part of our work.
And then we've got the low vision service for our sight impaired patients.
Yes, low vision, an essential service that we offer to our patients. Let's hear from Ali, our low vision practitioner.
Hello, my name's Alison Williams and I'm a specialist low vision practitioner. Our low vision service is available to anyone who is sight impaired or anyone who is having difficulty achieving the level of vision they require with regular spectacles. If you're struggling to see the small print on medication instructions or newsprint, or even recognise the faces of friends or family, then we have plenty of support available for you here at Smellie Opticians. A comprehensive low vision assessment takes approximately 60 minutes and involves a series of short interactive tests. If you live in Wales, you can access this service completely free of charge. We offer a selection of innovative, life-enhancing products and rehabilitation services that can help you carry on living your life to the full.
It's just brilliant. This is just such crucial work supporting these patients. Losing your sight is just terrifying, but there's so much support out there, and we just need to help our patients access it. So what's next, Amelia?
So we've got dry eye assessments and care, we've got punctum plug fitting, lacrimal syringing, and we've got Blephex.
It's such a big topic. So many people suffer with horribly dry and gritty eyes, excessive watering, which can be just so miserable for the patient. And it can all be caused by so many different factors.
There's your classic dry eye, which can be caused by dehydration, too much screen use, air conditioning, poor tear quality, or just not making enough tears. It might be that the lids and lashes just need to be kept clean of any bacteria or mite infestation. Heat treatment might also be used in the form of hot compresses to help open up the glands and help get the oils working again. Lubricants can be used in the form of drops, gels and ointments to help protect the front surface of the eye. It might be that we just need to reduce your exposure to screens and to air conditioning. And there's also punctum plugs, which we can fit to stop the drainage of the tears to ensure they stay in the eyes as long as possible.
Have we got a picture? There's the picture, lovely. So punctum plug fitting, it's just such a simple and pain-free procedure. And also for people with excessive watering of the eyes, if they've got blocked tear ducts, we can actually do lacrimal syringing, which is when we gently flush saline down the lacrimal apparatus to the back of the throat. It can work really brilliantly. We also can use Blephex to clean those nasty little mites off the lashes. Should we look at a picture of Demodex? Little devils, mites on the lashes, a lot more common than people think.
What's next?
How about the wonderful Sharon and her amazing audiology service? It's so brilliant to be able to offer another benefit to our patients, especially with Sharon's amazing knowledge and expertise. I have absolutely no hesitation in recommending her. And she does that brilliant, gentle wax removal, as well as fitting really great hearing aids.
Hi, my name's Sharon. I'm the audiologist and hearing aid dispenser at Smellie's Opticians. I work across the 3 branches in Chester, Wrexham and Whitchurch, and I've been working with the girls now for 5.5 years. I cover all aspects of hearing and ear care, including hearing aid provision, noise protection and all types of wax removal. This can be done on site in the branches or home visits on request.
Goodness, what else do we do? We must nearly be there now.
So there's that rather important subject of dispensing amazing spectacles.
Very important in an optician's practice. I think we need to get an expert on this one.
Should we hear from Helen?
Hi, my name's Helen and I'm the practice manager at Smellie Opticians in Wrexham. I'm also a dispensing optician, which means I look after all your eye care needs following your eye examination. We believe that it is vital for all our staff to be qualified to the highest level. Having dispensing opticians in each practice means that we have the knowledge to deal with all prescriptions, whether it be first-time glasses or the more complex request. As an independent opticians, we're fortunate that we can source any lens from any manufacturer, whether it be Hoya, Essilor, Zeiss, or anything that you would prefer. Each patient will have a consultation. In this consultation, we will try on frames, choose what style suits you, and then we would discuss the lenses that suits your prescription and the frame that you've chosen. We often dispense eyewear for sports vision as well. This could be swimming goggles, cycling specs, and quite often we do sports goggles for children.
We actually could make another film just about spectacles and dispensing and amazing sunglasses, couldn't we? But it's the red of the gas. I'm completely exhausted. I think I might go for a lie down now.
So, if you need any help or advice or want to know more about our services at Jane Smellie Opticians, please don't hesitate to get in touch.